viewers, welcome to another episode of my life experiences. Nyanewa Sosola, your usual host. If you are new to this channel, this is a place where I share life experiences with the hope that someone may listen, be inspired and learn from this. Today I just want to share another episode in my series, My Birth Stories. Must-haves and must-dos for a new birth. Items that are often overlooked. But before I do that, I just want to give a word of gratitude and appreciation to all the medical professionals out there for the good things that they do to us as patients. You know, sometimes as human beings, we are fond of complaining of how maybe at some point we are ill-treated or mistreated during our stay in hospitals. But today, just coming from my life experiences, I just want to give a testimony of how good some of these medical professionals can be, how I was well taken care of through the entire period of my labor, the complications that I encountered until when my baby was delivered. In an earlier episode, My Birth Stories Part 1, I shared some of these complications, but I was shown so much love, and I just want to say that you are seen and you are immensely appreciated for the good work and the love that you show to the patients. Even after the birth of the baby, they gave me invaluable advice of basic care for a baby, how to bath a baby, how to dress up a baby, how to change the diapers, for example, even how to breastfeed a baby. You know, sometimes these things are taken for granted. Like breastfeeding is not an easy task. It's a skill that has to be learned. The angle at which you hold a baby, because you have to hold the baby at such an angle that they latch on properly and they breastfeed efficiently. Because if they are not held at a proper angle, you may end up hurting your own nipple and it becomes uncomfortable for yourself and even for the baby. They may not breastfeed efficiently, and also sometimes you may find that you are smoothing the baby, whereby your breast presses on the baby's nose and the baby fails to breathe properly, and sometimes they can even become unconscious. So this is a skill that has to be learned. And I owe it to these angels in white for teaching me all these skills. Just like that, I don't take it for granted. May God bless you all. Now, must have number one, when you are going into the hospitals. If you are like me, when I had this baby, I was producing too much milk, production of excessive milk, to the point that even after the baby breastfeeds properly, the baby is satisfied, my breasts could still be engorged, they could still be full of this milk. So much so that it was causing pain to the whole of my chest area. I was feeling as if I was having some stabbing feelings in my whole chest area, and it was so uncomfortable, it was so painful. I was even having at some point some fevers, and when the medical professionals came, they told me that no, you don't have malaria, you don't have neither do you have an infection, it's just that you have too much milk and it has to be drained from your breast. And what my guardian was doing, she was squeezing some of the milk off herself with bare hands, just for me to feel a little bit comfortable. So one thing I learned from that is that you need to buy, if you are like me, buy a breast pump. You never know, sometimes you can produce too much milk. I know of some women who don't produce enough milk, but sometimes if you do that, just go in the hospital well prepared, have this breast pump. In case you experience that, it will come in handy for you. Must have number two. Babies comes in all shapes and sizes, and sometimes they may come very small, too tiny, 2-point-something kgs, 3 kgs, very small babies. And I've found that nappies, the cloth nappies, these small thin nappies, they are so helpful for a new baby. Of course, you may buy diapers, but in the first week of the baby's life, I find that these small thin nappies, they are small to fit their size. If they are a small baby, you can just wrap it around them properly, taking care of this area where the umbilical cord the umbilical cord has been cut. You just wrap around it properly, and since these nappies are soft, the baby can really be comfortable, because I find the diapers sometimes they are a bit tough. So for a small baby, sometimes they are big, it doesn't fit properly. So just consider buying these small nappies, the thin nappies, not the coarse, the tough ones. No, these cheap small nappies, they do come in handy. You can just have 2, 3, or 4 of these, especially in the first 2 weeks, for example. They would really be helpful for you. That's just another must-have for you. Now, must-do. When you are in the hospital, keep the number of guests to a minimum. Number of guardians, number of visitors. Of course, when you have given birth to a baby, sometimes people are concerned. For example, for me, when I had given birth to my baby, my parents were in the village. They had heard that I had gone into labor, but once they were told that after some hours I haven't delivered yet, they were so concerned. My father, my mother, they both came to the hospital. So it was like 4 people in the hospital: my mother-in-law, my mom, my dad, my sister-in-law, who was my official guardian. They were all there. The entire period they were there. They were just chatting among themselves. So this robs you the time for you to rest properly, because when you have given birth, it's a very this is a job that you do. Yeah, it wears you out. So you really need to have some time to rest. And if you've got all these visitors coming in and out, these guardians that are just staying there, you fail to rest properly. So you need to keep the amount of guests to a minimum as much as possible. Tell them that, no, I want to rest a bit. And if you are sending out this information that you have given birth, maybe delay by a few hours, so that at least after the birth, you rest properly. When you are well rested, that's when maybe these people can come. For me, I had these 4 people. The entire time, from morning to evening, they were just there chatting about. And what happens, a day after you've given a cesarean section birth, you are expected to get up and to start walking, so that the wound heals properly. And the nurses told me that get up, walk upright, try as much as possible to walk in an upright position, so that you heal properly, the wound heals out. But when the nurse had gone out, my mother came to me and whispered, saying that, Wezi, when you are walking, try as much as possible to bend your back. Don't walk uprightly, because if you walk uprightly, vikufampuka nyengo zinyake, sometimes this wound may split open, vikufampuka. So you should walk with your back bent. So you can see I had this guardian who was giving me conflicting information from what the nurses were giving me. To the point when the nurses found that it was too much, they had to chase this guardian away. They said, you know, you are too many guardians here. You need to go home. Go home. This is not the village. We will take good care of your patient. We only need one guardian in this place. So the point of having well rested, and also the point of not getting conflicting information. Very important. Keep your guests, keep your guardians to the minimum. Advice number 2, must do. Be lenient on yourself. Don't be too hard on yourself. Because for me, for example, when I went out of the hospital, I'm now at the home. All the guardians are gone after a week. They are gone, everybody to their various homes. Now the reality hit for me. I was all alone. I was supposed to bath the baby. I was supposed to feed the baby, to rock the baby, to wash the nappies for the baby. And during those times, we did not have these diapers readily accessible. So we are using actual cloth nappies. And I had bought the big nappies, Glaudina. That's the brand. And they were so thick. And you really had to wash those nappies, wash all the clothes. And washing nappies is not an easy thing, because they are white. And you want to wash them to be spotlessly clean. And what you do, you rinse them off. You apply the soap, you soak them in warm water, After they have soaked for a bit, you wash them and you put them on the drying lines. So just imagine for somebody who has just given birth to a baby through a cesarean section, the wound is just 1 week old, I'm not entirely healed, and I have to do all those chores. It was weighing so hard on me, it was weighing so much on me, such that I was getting stressed, I was getting exhausted. It was just too much on me. So, because I had made a decision that, okay, I just want to take care of the baby myself, I don't want to recruit a house help to help me with taking care of the baby, at least for the first few months. That's what I want to do. But that was a bad decision for me. Don't be too hard on yourself. Be lenient on yourself. You don't have to prove to be a super mother. You don't have to prove to be a superwoman. You are a person and you have got weaknesses. You have got weaknesses. You have done all this big job. You've produced this whole human being in your body, and your body is weak. It needs time to regain the strength. So don't put so much pressure on yourself to say that I just want to take care of this baby myself. I'll do everything to prove to be a superwoman. Don't do that. Be lenient on yourself. And another point, my baby was so colicky. Used to cry a lot just coming from colic. And most of the times I was just out there rocking the baby. And really, it was so tiresome for me. So those are the must-haves, must-dos for you. Don't forget to do that. Buy a breast pump. Buy small nappies. Limit the number of guardians and guests. And also, make sure that you get help for yourself. You really need that help. You don't have to be a superwoman. You are just a weak human being. You need help too. I hope this episode has been helpful to you. If you are just preparing to have a baby, or if you have just had a new baby, I hope this advice is sufficient to see you through. Thank you so much. Don't forget to like this channel, to share, and also to subscribe. Thank you so much, guys. Stay blessed.